A brain hemorrhage, also known as a cerebral hemorrhage, is a medical emergency that occurs when there is bleeding in or around the brain. This condition can be life-threatening, requiring immediate medical attention. Understanding the symptoms of a brain hemorrhage is crucial, as early detection can significantly improve the chances of successful treatment and recovery. In this article, we will explore the symptoms of brain hemorrhage, its causes, risk factors, and the necessary steps to take when faced with this medical emergency. Understanding brain hemorrhage. A brain hemorrhage occurs when a blood vessel in the brain ruptures, leading to bleeding in the surrounding tissues. The increased pressure from the accumulating blood can damage brain cells and cause life-threatening complications. There are different types of brain hemorrhages, including intracerebral hemorrhage. This type of brain hemorrhage occurs when a blood vessel within the brain ruptures, leading to bleeding directly into the brain tissue. Subarachnoid hemorrhage. This type involves bleeding in the space between the brain and the thin tissues that cover it, subarachnoid space. It is often caused by the rupture of an aneurysm or a weakened blood vessel. Subdural hemorrhage. This type involves bleeding between the brain surface and its outermost protective layer, dura mater. It is commonly the result of a head injury or trauma. 2. Symptoms of brain hemorrhage. The symptoms of brain hemorrhage can vary depending on the location and extent of bleeding. They can range from mild to severe and may develop suddenly or gradually. Common symptoms include severe headache. A sudden, intense headache is a classic symptom of brain hemorrhage. It is often described as the worst headache of my life by those experiencing it. Nausea and vomiting. Brain hemorrhage can trigger nausea and vomiting, which may be persistent and unrelated to food intake. Weakness or numbness. Individuals may experience sudden weakness or numbness on one side of the body, often affecting the face, arm, or leg. Trouble speaking or understanding. Speech difficulties such as slurred speech or difficulty understanding others may be evident. Vision problems. Blurred or double vision, visual disturbances, or complete loss of vision in one or both eyes can occur. Loss of coordination. A person may have trouble with balance, coordination, or walking, resembling symptoms of intoxication. Confusion or disorientation. Brain hemorrhage can lead to confusion, memory problems, or an altered mental state. Seizures. Some individuals may experience seizures or convulsions. Loss of consciousness. In severe cases, a person may lose consciousness, or they may remain in a persistent coma. 3. Causes and risk factors. Brain hemorrhages can have various underlying causes and risk factors, including high blood pressure. Uncontrolled hypertension is a significant risk factor for brain hemorrhage, as it weakens blood vessel walls over time. Aneurysms and AVMs. Abnormalities in blood vessels such as aneurysms, weakened bulging areas, or arteriovenous malformations, AVMs, increase the risk of rupture and bleeding. Head trauma. A significant blow to the head, such as in a car accident or a fall, can cause brain hemorrhage, especially in older adults with brain atrophy. Blood disorders. Conditions that affect blood clotting, such as hemophilia or anticoagulant medications, can raise the risk of bleeding. Liver disease. Liver problems can lead to a reduction in blood clotting factors and increase the likelihood of hemorrhage. Age and gender. Brain hemorrhages are more common in older adults and slightly more prevalent in men than women. Family history. A family history of brain aneurysms or other vascular disorders can increase the risk. Drug use. The use of illegal drugs such as cocaine or amphetamines can raise blood pressure and contribute to brain hemorrhage. IV. Seeking immediate medical attention. A brain hemorrhage is a medical emergency that requires prompt action. If you or someone else exhibits the symptoms mentioned earlier, it is essential to seek immediate medical attention by calling emergency services. Time is critical, and any delay could lead to irreversible brain damage or even death. Once at the hospital, healthcare professionals will perform a thorough evaluation, which may include neurological examination, assessing reflexes, muscle strength, sensation and coordination. Imaging tests, CT scans or MRIs are commonly used to visualize the brain and identify bleeding. Cerebral angiography. This procedure involves injecting a dye into the blood vessels to highlight any abnormalities. Lumbar puncture. In some cases, a lumbar puncture, spinal tap, may be performed to check for signs of bleeding in the cerebrospinal fluid. V. Treatment and recovery. The treatment of brain hemorrhage depends on its cause, location, and severity.